Hey everyone, it's me again. I am now in week 4 officially, I think, of PA school. Honestly, it's really hard to keep track of exactly what week it is. I want to say it's week 4 though. Um, so I thought I would just make a really quick video tonight. I don't really have time to make a video. I never have time to make videos, but especially tonight because it's already almost 9 and I usually like to start studying by 9. But I'm really excited today because I took my first exam in Clin Med, and I'd studied really hard for it, obviously, and felt prepared but still nervous because it's the first big one. And I got an 89 on the farm part. I got a 96 on the clinical part and a 94 or 95 on the pathology, the pathophysiology part. So I'm so excited. Like overall, that's like a 93 on this exam. So it's awesome for my first exam. And so I'm kind of like encouraged and motivated to just keep making videos because I'm thinking maybe I'm not gonna fail out. Maybe I am gonna do good. Um, so I wanted to, if anyone's tuning in for the first time to these videos, this is my third video that I'm making. My name is Lila, and I am a PA student at DeSales University. And I am making these videos just to kind of be a reference point or a resource for anyone who's thinking about going to PA school and is just curious about what it might be like to be a PA student in general, but specifically what it's like to be a PA student when you're also a mom and a wife and uh, and someone with a non-science background and someone who's kind of afraid of like blood and trauma and guts and stuff. So just a little word about my videos. They're usually spoken in a soft tone. I would probably not ever speak louder than this because I make them at night when my children are sleeping in the room next door. I don't usually look very good in these videos because I am a PA student and a mom and a wife, and I don't really have time to keep up with my makeup, or I don't show my hair, but my scarf, like I just slap it on. And what else? Oh, and there's gonna be nothing fancy about these videos. Like I'm not really doing any editing or like graphics or anything like that or soundtrack because I just don't have time. So if you're thinking about being a PA student and you're curious, want to see an inside look at what it is like to be a PA student from the very beginning, this is the video for you. And if you are a parent, definitely a video for you because it is like a whole different ball game, I think, when you're a parent and you're in PA school. So today is Monday, and I thought I would just make a video on each day of the week and kind of give you a picture of what that day looks like. So on Mondays, if we have an exam, which we did today, we take the exam at 8 o'clock in the morning, and we're allotted 2 hours, like roughly. Actually, I think it's only an hour and a half. It's an hour and a half for the exam, and then you have a half an hour to like recoup until your next thing. So I finished my exam in like less than an hour, I think. Um, no, maybe like an hour and 10 minutes. I think I took it in, but it was a lot. It was 108 questions, and it was all about the esophagus and the stomach and the anatomy, the microanatomy, the physiology of those systems, and diseases, different pathologies that you can see within those systems and what the symptoms are, and the diagnostic tests and treatments and presentation, clinical presentation, all of that. So it was very comprehensive, and then it also had like the treatment, so you had to know like all the drugs because it's a Clin Med Pharm class. So you have to like know the medications, their method of action, their classification, their side effects, and also like their interactions, drug interactions with other medications. So it's pretty comprehensive. But I got a 93, and I'm so excited about that. Okay, so after the exam, then at 10:30 you have what's called clinical reasoning class, and that goes until lunchtime, which lunch is at 12. So from 10:30 to 12 you're in a lecture with everybody. Our class has 80 people in it, so we're all in the lecture hall, and we basically today went over a case where a patient came in and said she was 29 years old, and she's been having migraines for the last 10 years, and they've just been getting like worse over the last few months. And she's like having vomiting with her, well, she didn't say the word migraine, she said really bad headaches. She's been having vomiting, and she's just coming to the doctor because her mom wants her to get checked out. So we spent the whole hour and a half thinking about differential diagnoses, like what could it be, what could we be looking for, what questions could we ask, what do we think it is, what things can we rule out based on what she says and her history and all that. So that was interesting. And then we have lunch from 12 to 1, and then from 1 to 3 we have anatomy lecture. So it's 2 hours of PowerPoints by a professor who is an orthopedic surgeon, and he's so sweet. He's really great. I really like him. But he goes so fast through these slides that no one can keep up. Like, no one in the class can keep up with him. So luckily I record the lectures, and like whatever night I designate to doing anatomy, I listen to the lectures again and I put all my notes on the PowerPoint or on Quizlet, which is actually what I've been doing. I've been making flashcards for myself on Quizlet as I listen to the lecture. I just make all kinds of questions on the Quizlet, and then I have like all these flashcards to go over. So 2 hours of anatomy, which is basically like just not keeping up at all. Then, okay, so then from 3 to 5 today we had history and physical exam. That's a class, and it's like a class. One day it's a lecture and one day it's a lab. So today was the lab, but today was unique because we had what was called a specialized patient, no, a standardized patient, which is the opposite of specialized. A standardized patient, which is basically an actor who is pretending to be a patient, and we have to like go in the room, knock on the door, go in the room as if we're the PA, and our task for this unit was to do a complete history and vital signs. So it was nerve-wracking, to say the least, to like go in with this patient who's a real person. It's not like your classmate. Of course, they're an actor, but still. And you had to ask them all these questions about their history. Like what's wrong with them today, and then ask questions about that. When did it start? How long has it been going on? Is there anything that makes it better or worse? Have you tried anything to help it along? All these questions. And then they're supposedly a new patient, so you actually have to ask them about their social history and their past medical history. And then you have to do a review of systems, of all the systems. I think there's like 12. And you have to ask them, like, do you have any rashes? Do you have any muscle weakness, any dizziness, any like really strange things like endocrine symptoms? It's a lot, but it's just to kind of like get us used to knowing what goes into a complete physical and practicing that. So my patient today, he said, because then after you do your presentation, you go out of the room, and then they call you back into the room and they get to give you feedback. The patient gives you feedback about how you did. And my patient said that I came off as incredibly confident and smart and very kind, and I made him feel very comfortable. And he said that I made him feel like he was in good hands, because I seemed like I was like really smart and I knew what I was doing. And I was like, wow, that's really impressive, because I was really, really nervous. And he's like, well, it didn't show. So he was really impressed, and he said that I did a really good job, and he thought I did great. So that was like a nice ego booster. And then my exam grade was a big ego booster. So after that, so that class is from 3 to 5. So after that, then the professor like takes us in a room and goes over everything again, like what we should have done. And they didn't like watch us, but they just theoretically tell us what we should have done. And then that's it. So it's over at 5. So I started at 8 a.m. and I'm done at 5. And then just from a personal point of view, when I get up at 6:30 in the morning, I have like my kids, I like make myself breakfast and eat breakfast, and then my kids wake up and I make them breakfast, and I don't get them ready for school. My husband's home in the morning, so he does that, thank God. I have a 5-year-old in kindergarten and a 4-year-old in preschool. So then after class at 5, I come and I pick them up at the YMCA, my 2 kids, and I bring them home, and my husband already has dinner made because he makes it in the day when he's home. And he's not here when I get home. He's gone to work, but at least I have dinner ready. So I feed my kids at like 6:15, 6:20, let them go outside and play until 7:30, and then I come in and I get them in their pajamas, and if it's a bath night, I give them a bath, which it wasn't tonight, thank God. And then I put them to bed by like 8:15 after story time. And then from 8:15 to 8:30, 15 minutes of my entire day is basically like me time. Like I can like read if I want, I can go on Facebook, I can do a workout, which is what I usually do, like a little 10-15 minute workout. And then from 8:30 until 11:30, I'm studying 3 hours straight. And I try to be to bed by 12 if I can. 12:30 the latest because I have to get up at 6:30. So anyway, sorry if that was really boring, but if you wanted to know what it's like to be a PA student, that's what it is. And that's just a Monday. So I'll tell you about Tuesday the next time I make a video. But yeah, if you guys have any questions or anything like that, just put it in the comments section. I'll do my best to answer any of those questions. Again, I'm only on week 4, so I'm certainly not an expert, but I have a general idea. And I would love to help you guys out, answer any questions that you might have. Okay, see you next time. Thanks for tuning in. Yay, PA student. I'm surviving.